Hello and welcome. My name is Anya Garone. I am the acupuncturist, herbalist, life health coach at OSHA Center for Integrative Medicine at Northwestern University, affiliated with Northwestern Medicine. I have been here for about 17 years, since 2003, and I have had the privilege of practicing this ancient traditional Chinese medicine, this ancient medical system in the context of the Western teaching medical institution, which has been very, very exciting. So I would like to offer you today an invitation, an introduction into Chinese medicine that will both make you familiar with the ancient principles on which the medical system was designed, but also some of the exciting new research and science behind some of the modalities that we use in Chinese medicine that will demystify what Chinese medicine is and hopefully make it a little bit more useful and helpful for you to integrate it in your own practice as Western physicians. So let's dive in. We will cover a lot today. We will be covering some just touches on philosophy of Chinese medicine, modalities. I will explain the acupuncture, which is the most misunderstood and exotic modality of Chinese medicine. We will talk about herbs. We will also talk about some of the unique diagnostic tools in Chinese medicine. And what does it mean to use Chinese medicine as a part of integrative approach? Questions and answers. This is something we will not be able to do since this is not exactly live. I use this presentation for live workshops, but at any point if you have questions following this presentation, you can always send me an email and the contact information will be provided at the end of the presentation. I also would like to give you some practical application of auricular acupuncture that you can use yourself, with your family, with your friends, with your patients, that is aimed at calming down and decreasing stress. This is, I just thought it would be fun to have something practical that you can take away from this presentation. So, philosophy. Chinese medicine is a system that was designed or developed on a matrix of a certain philosophical constructs. First of all life occurs within a circle of nature. Human beings are no exceptions. We are animals and we are subject to the same laws that govern any alive creature in this world. And everything is connected. Everything is mutually interdependent. We do not exist out of context. Humans need to remain in harmony with nature to remain healthy. That is something that in our modern world we often get away from. But if we connect to that very fundamental truths that we need to obey the laws and do whatever it takes, we will be able to keep disease at bay for much, much longer. Life and death balance each other, seen and unseen, soma and cycle are in constant flux. What that means is that, again, everything is everything in Chinese medicine. Nothing is in isolation. We are not a bag of parts. We are very much dependent on our environment, on our connection to the divine, to the spirituality, to other people, to our beliefs, to our rules, to the things that we grew up with, our religious beliefs. Everything has a capacity to impact our state of health or disease. One of the very important philosophical constructs of Chinese medicine is that our health is dependent on moderation and preventive action. It takes much less energy and effort to prevent something than to fix it after it's already broken. And health is function not just in natural but also social order. Our relationships have a tremendous impact on our state of health. Chinese medicine developed historically along two tracks: preventive and interventional medicine. Preventive medicine was historically reserved for the wealthy, the affluent, the families that had an opportunity to hire a physician whose primary job was to keep the family healthy. At a royal level, if a family member would fall ill and die as a result of it, the physician could lose their life. How's that for motivation to keep people healthy? This is just a historical anecdote, but the middle-class family who didn't quite wield that kind of power, what they would do is often hire a physician who, as they were caring for other families, if someone in those families would fall ill and die as a result of that illness, the physician had to light a lantern in front of their house. So if you, as an affluent family member, head of household, was searching for a physician, all you had to do was to visit their home and see how well they're doing. So that's where preventive medicine, anti-aging branch of Chinese medicine developed, is in that context. And of course, there was an interventional medicine, which was a medicine for the poor people who could not afford a physician until and unless there was a dire need and they really needed to reach out, which is not unlike our modern, current Western model of medicine, where we don't go to the doctor mostly for prevention. We go to the doctor when something breaks. Some of the principles and theories of Chinese medicine is based on this ancient philosophical construct of yin and yang. The idea is that the yin and yang provides a basis for the entire universe. It's a principle of everything in creation. It brings about the transformation to parenthood. It's the root and the source of all life and death. Heaven was created by the accumulation of yang, the earth by accumulation of yin. The ways of yin and yang are to the left, to the right, water and fire, the symbols of yin and yang. So yin and yang are the source of power and the beginning of everything in creation. So everything contains its opposite. It's a symbolic representation of the universe. It talks about changing rather than static nature of reality. Designation of yin and yang are always made in relation to each other. So you can have day and night, you can have hot and cold. None of them exist in isolation. They have to have their opposite in order to make any sense. These similar distinctions were created or assigned to different parts of the body. So organs function. So abdomen is yin and back is yang. Fever is yang. Chills are yin. So everything contains its opposite in this constant, ever repeating a cycle of life. They don't cause each other. They flow and morph into each other, so they are intricately interconnected. In the body, substance and blood fluids, tissue is yin, and yang is the functional aspect, the metabolic aspect of the body. The equilibrium between yin and yang ensures that there is a harmony. So if any of these elements go out of balance, we have disease. The eight principle theory in Chinese medicine is a way to organize symptoms. So Chinese medicine is very poetic and also recognizes that everything in the universe, everything in nature, and everything also in the human body is governed by the same law. So all symptoms are categorized by putting them in these sets of distinctions. So yin and yang is one of them. External or internal, we can talk about pathogens either coming from the outside of the body or inside of the body. Excess of acuity, so the locale of the disturbance is judged by the presence of symptoms in the exterior region, so affecting skin, hair, muscles, joint, peripheral blood vessels, nerves, and meridians, or the interior region, and affecting the visceral organs, the deep vessels, the nerves, the brain, the spinal cord, the bones, and also internal or external origin. So natural elements like heat, cold, damp, dry, wind, or internal evils, which are emotions, for example. And we will talk about a little bit of the impact of emotions, but emotions in and of themselves are not pathologic. However, if they are not resolved, processed, and physically gotten out of the system, they will affect over time structure and function. The excess of acuity, the virulence of the pathologies is compared with the inherent strength of the body. By the presence of the symptoms and qualities, they indicate either excess or deficiency. Excess refers to more of the noxious pathogenic factors like adverse climates or emotions or abnormal accumulation of energy or blood or fluids. Deficiency, on the other hand, refers to more of a lack of fundamental constituents like lack of energy, lack of fluid, lack of blood, all of that. Hot and cold are the energetic activity of the organism. It's determined by the quality that distinguish physically between heat or cold. So you can have a person with, hot flashes and a lot of inflammation and redness. That's going to be considered a heat presentation. Or cold, which is going to be feeling constantly cold, a lack of circulation, cold limbs, and symptoms like that. The way we in Chinese medicine, we categorize these symptoms and put them in the categories is to figure out what is the underlying pattern of imbalance on the background of which the person presents with a sinus symptom. So the constellation of these distinctions creates a pattern. And many different patients can come in with the same Western diagnosis. They may come, say, with a diagnosis of a headache, but they will have different distinctions. It could be an excess hot headache, or it could be a deficient hot headache, or different kinds of pattern of imbalance. So these 10 people that are coming in with headaches may have completely different presentations, different underlying patterns, and therefore they will receive completely different treatments. Chinese medicine always attempts to restore balance by enhancing the self-healing and help the long-term problems. Another theory that we use to categorize symptoms and also make sense of what's going on in the body is a five-element theory. The idea here is that everything in nature functions according to a specific flow of energy. So elements symbolize 5 different inherent qualities or states of natural phenomena. So all beings and phenomena in nature are based on their characteristic, can be ascribed to one of these 5 elements. So the 5 elements are wood, fire, earth, metal, water, and each of the organ systems within the body belongs to one of these phases. They mutually engender and control each other. So this is what this would look like. So if you look at this diagram, you see wood, fire, earth, metal, and water. Wood, if it burns, if you think about it in nature, nomenclature, if you will, if you have nature phenomena, when wood burns, you have ashes. So you create from wood, there's fire, from fire, there's earth, those are ashes, that generates metal, metal generates water, water nourishes wood. So that's the outer circle interrelationships, which each organ system supports the other. But there's actually also these controlling influences that some kind of excessive condition in one organ can adversely affect the other. So for example, if you look at relationship between wood, fire, and earth, wood in Chinese medicine is liver, gallbladder. So somebody with a lot of anxiety and anger and stress, they can manifest symptoms along the outer circle, which would go to the fire, which is heart and small intestine, the digestive, upper digestive problems, bloating, gas, or heart problems. Or it can go on this inner star on the inside. You can see those arrows to the earth element, which is the spleen, stomach, the digestive system. So that's a person who experiences a lot of anxiety and anger, and it all goes into their gut. So being able to categorize the symptoms and see the interrelatedness of the organ systems and how one affects the other helps us make sense of symptoms that from a Western perspective often are unrelated and make absolutely no sense. But from the Chinese medicine perspective, if we can find these interrelationships, we can then address them with a specific acupuncture or herbal prescription or other things that may be appropriate to break these cycles of unhealthy relationships. Some of the other concept in Chinese medicine is, of course, everybody heard about the idea of qi. Qi is the special form of energy that flows freely through the system of the tracts of the meridian. The health-giving balance between yin and yang only exists when this special form of energy flows freely. The disturbance in the flow disturbs the balance, and that creates pathology. So qi, or energy, is that which animates life. It's the difference between a dead body and a live body. Life is defined by its energy. Material world is formed by energy. Matter is qi, is energy taking shape. Modern physics has shown that matter and energy are just not distinct. They represent two aspects of the same thing. So in some situations, it's easier to explain something in terms of matter and others in terms of energy. So likewise, all events in the organism, whether they are physiological or psychological, involve both matter and energy. So it doesn't seem at all contradictory in terms of to describe things both in terms of energy flow and physiological mechanism in order to explain what's happening when disease developed and acupuncture is performed. So let's see. What are the modalities of Chinese medicine? We're going to touch briefly on all of them. So acupuncture, herbal medicine, Moxabustion, cupping, tuina massage, dietary therapy, exercise, qigong, and meditation. Often people think that Chinese medicine is acupuncture. Chinese medicine is a complete medical system. It's a system of therapies, modalities, philosophies that is a system that stands on its own legs. So acupuncture is just one little branch of what we do in Chinese medicine. But let's dive in and let me explain acupuncture from both the traditional and scientific view. So the traditional view of acupuncture is that it's energetic medicine. If you see this picture of a man with the lines on the body, these are meridians. These are lines upon which the acupuncture points are positioned. And in traditional view, these energetic lines connect with underlying organs and they connect with the skin, where the energy in those organ systems can be accessed through the acupuncture point. And disease, being a function of some kind of disturbance of energy, can be moderated and can be alleviated by sticking a needle through those spots and reestablishing normal energetic flow. So as we stick a needle in and move energy, that brings the health about again. So that's the traditional view. Modern science understands acupuncture points as areas with more dense supply of nerve bundles. And there is a possible activation of hypothalamus and pituitary gland resulting in alteration of peptides, hormones, neurotransmitters, and the regulation of blood flow. Acupuncturists also seem to facilitate gene expression and molecular changes in nervous system and hormonal system and immune systems. It modulates powerful, non-specific effects and the placebo response as well. Anti-inflammatory action of acupuncture is shown to work through balancing mostly sympathetic and parasympathetic systems by its electrophysiologic effect on neurotransmitters and cytokines and neuropeptides. And analgesia is mediated by the endogenous opioid system. Immunostimulation works by increasing blood cells and enhancing natural killer cell and lymphocyte activity. So this is also an area of lower skin resistance, higher carbon dioxide, and more biophoton emission. We're going to talk about it in a second, and better transmission of acoustic nerves. So there is a different innervation of acupuncture points. They're primarily A delta efferents and sympathetic efferents, which in combination with the sweat glands, which they innervate, are responsible for lower electrical resistance than skin elsewhere. Trigger points, it's different innervation than trigger points, which by difference are intramuscular, predominantly C efferent innervation. So they're not the same thing. The acupuncture points, it causes a release of a number of different biochemicals. Endomorphins, they regulate sedative and arousal behaviors. Enkephalins, which inhibit emotional and physical impact of pain. Neurokinins A and B, they're potent vasodilators. They contract smooth muscles, they excite neurons, they evoke behavioral responses. Substance P, which is a vasodilator, it directs cellular growth, mood disorders, stress, neurogenesis. They also affect serotonin, which regulates intestinal movement, appetite control, metabolism, sleep, mood, anger, growth factor, and other peptides in various areas of brain and body. So there is no magic here. There's a very physiological response as to what happens when acupuncture is performed. I actually found a better explanation I don't know, so I'm really excited to share it with you. So in 1960s, a Korean scientist, Kim Bong-en, found a specific dye which isolated physical anatomical structures on the meridians. They're not imaginary lines, they're not just energetic lines, they are real deal. They are tiny little thread-like transparent tubes that are between 30 to 100 nanometers in diameter. You can find them in skin and organ surface, inside blood and lymphatic vessels. They're full of hyaluronic acid, and they have a peristaltic movement. They can carry more information than limited one-way signals of the nervous system or the diffuse information carried by hormones. They have a light conducting ability. We're going to talk a little bit more about that. And the flow of liquid in the hyaluronic acid, which actually correlated with the therapeutic effect resulting from acupuncture treatment of damaged internal organs. They were mapped out with the use of magnetized nanoparticles. So this research was shelved for many, many years because Kim Bong-gun would not divulge the formula for his dye. So only in probably the last 10 or 15 years, different universities around the world picked it up and were able to replicate these studies. The structures of Bong-gun channels are different and they're differentiated from fibrin or lymph vessels. They are semi-transparent, they are barely visible, they are in a bundle structure with rod-shaped nuclei. They don't converge in lymph nodes, they don't adhere to organs, and they do contain DNA. They also have a very well-developed branches. They are joined to like a corpuscle. You can see the little picture up there. And they contain higher concentration of DNA than the channels. But there's a small amount also of these granules flowing in the liquid in the chemicals. So the lymph nodes, on the other hand, are single tubes. They are fixed to the vessels of organs, and they join at lymph nodes. So this is a different structure. And the staining technique found that they include the whole meridian system under the skin and in deep in the organs and even in the lymphatic system. So this is really, really exciting because how did the Chinese know that? They did not have magnetized technology or funky dyes and microscope to be able to map this all stuff out. So it just always amazes me that that this newest technology confirmed something so long known without any of this technology available. The liquid flowing through the Bong-gun channels contain those little DNA granules. When these were taken out and prompted to grow in vitro, they actually developed into all 3 germ layers, suggesting that meridians are sources of our own adult stem cells. As you know, stem cell can develop into any tissue in the body. So this is a very, very exciting finding. The emission of photons in visible range by living cells have been also established by many authors. The biophotons produced by tissues may be emitted by those DNA little granules to produce a laser light, coherent light, capable of carrying enormous amount of information through the Bong-gun channels. Light can be transmitted along these channels, and it can enter or exit through the acupuncture points. So Bong-gun channels actually compared to fiber optic channels in the body, capable of, like I said before, carrying tremendous amount of information far beyond what the nervous system or the hormonal system can do. So I hope you're as excited as I am. I know this is a little nerdy, but this is, they did some more studies and they found that the acupuncture meridians, so they did the studies in the context of embryonic development, and they found the meridians begin to form within 12 to 15 hours of conception. It seems to be the structure responsible for embryonic growth. So an unfertilized egg has a top and a bottom, but there's no distinction between front and back, left or right. So without this primary axis of orientation, the embryo can't develop. So the stimulus must come from the outside, and it's provided by the action of the sperm entering the egg. And from that moment on, a guideline is provided from the entry point of the sperm to the top and the bottom poles of the cell. So the first time the fertilized egg divides into 2 cells, everything lines up along this meridian. So the side along which the sperm entered becomes the belly or the yin side, which is subdivided into right and left orientation by the Ren meridian, the meridian that runs in the center front of the body. The opposite side is the yang or the back side, which is subdivided by the due meridian, the governing vessel, again into the right and left. So there was a Dr. Charles Schrank who did a research around in this area. And what he did is he found that both acupuncture points and embryological organization centers are areas of high electrical conductance, and they both contain high density of gap junctions and cellular organelles that facilitate cell-to-cell communication. So because embryonic development reflect evolutionary development, it's actually quite likely that the meridian system has more ancient origins than other physiological systems. It's like genetic blueprint, which might have served as a template from which the newer systems are evolved. So plants, for example, they don't have a nervous system, yet they display a high degree of structural organization and really complex responses to the environment. So the research published in the Scientific American in 1984 that describes the effect of light transfer through plant stem. We actually have been looking at the ancestral precursor to the meridian system. So let's see here. I got excited and I forgot to forward the slide. So they continue to coordinate information, and there's some overlap between the neuroendocrine theory and the meridian theory, because obviously the nervous system developed on the matrix of the meridian. But there's significant difference here. When you stimulate a nerve, I know exactly what's going to happen when I stimulate a nerve. If I'm going to stimulate your vagus nerve, I'm going to slow down your heart rate. Acupuncture, on the other hand, the same point can increase or decrease peristalsis, heart rate, blood pressure. The body somehow knows how to use this stimulus to its best advantage. So it's like a blueprint, a direction in which the body needs to go to heal, repair, and make change. So it is, it's not exactly the same thing. We are stimulating nerves, but there's a lot more that's going on than just nerve stimulation. So I hope I got you excited, because to me the science behind it is extremely fascinating and really exciting, because I understand now what happens in clinic while I treat patients. I would have sometimes a patient who comes in with a very straightforward pain. For example, they would say, okay, my knee hurts, please fix it. And patient is the boss. So it's like they are not interested in Chinese medicine. They're not interested in the whole acupuncture meridians. They just want their knees to not hurt. And I will do the acupuncture to the best of my ability, trying to get as much information as I can from this patient and treat their knee. And they may come back and they say, well, my knee's better, but also I'm sleeping better. I'm less stressed. My digestion's improved. Now, neurologically, it makes no sense. However, if you look at acupuncture meridians, these channels connecting tissues, they are geographically far apart, neurologically not necessarily connected, but they come from the same embryological source, therefore they have a very intimate relationship. Now all of a sudden the clinical outcomes start making sense. So let me introduce you to other types of acupuncture. So what we practice in my clinic is also scalp acupuncture, which is not, strictly speaking, traditional Chinese medicine. It's more of a modern invention in an advent of the modern neuroscience, where they found that there's correspondences between areas of the scalp and areas of the brain. So this is an acupuncture system that is treated for a lot of neurological disorders, post-strokes, things like that. Auricular acupuncture. So that's an interesting one, because that's the one that there's a lot of people that claim this as the originators of auricular acupuncture. The first use of it was about 2100 years ago, where in Huangdi, Neijing, it was recorded the relationship of the ear with the meridians, the organs, the human body, physiology and pathology. The bleeding of the ears could treat heart diseases and headaches and abdominal pain and blood stagnation, which is pain, painful menstruation. So they found that there are correspondences between every organ, every system, every structure, and the ear. So ear is like a microsystem. It's a holographic system. It contains all embryological tissues from which the body evolved. So which there are 4 of them: ears, hand, feet, and eyes. So you can have correspondences between the entire body and any of these 4 areas. And auricular acupuncture uses ear, obviously. So it has its roots in traditional Chinese medicine, but it was actually systematized by a French neurologist, Paul Nogier, who discovered the somatotropic properties of the external ears and published the first embryological ear map in 1957. So it's a complete bioholographic unit. It's supplied by a branch of vagus nerve, presumably can affect structures in internal organs supplied by the nerve. I will give you, at the end of our talk, I will give you a auricular protocol, as I mentioned before, for relaxation, and you can practice this and see how that works for you. There's a beautiful point there, which I will tell you the anecdote of my son, but auricular acupuncture works. So, and it's very simple to use, does not require disrobing, and it's something you can, as a practitioner, you can learn easily, and you can also teach your patients. Other types of acupunctures that we use, again, not strictly speaking traditional Chinese medicine, we are utilizing the benefits of a modern science and technology, which is laser acupuncture. So the photons, we talked about how acupuncture meridians are capable of contacting light. So it's a laser, it's a light therapy. So all particles are identical. They all are march in the same direction. It's a monochromatic coherent light. When that light hits the mitochondria, the center, energy on the center, changes the way the cell membrane functions. It increases the electron transport, the ATP, the nitric oxide, blood flow, reactive oxygen species, and it helps restore normal function. Stem cells can be activated, allowing increased tissue repair and healing. I will often see patients post-surgically, for example, who at 6 weeks look like their scars are 6 months old. The application of it is fantastic for areas that don't have an inherently fabulous blood supply. So tendons, ligaments, structures that don't have a lot of overlying tissue. The depth of penetration of this particular laser is only a few inches deep. It's very local, so it would not work very well, say, piriformis muscle, but on wrists and knees and ankles and injuries in those areas, it works phenomenally. It is there's really no documented adverse reactions to this particular laser other than direct exposure to the eye. We don't do that. And tumors, masses, things that shouldn't be there to begin with, because it is tissue generative. It helps build blood circulation. So obviously you don't want to feed something that shouldn't be there to begin with. This is also an amazing strategy for people who are immunocompromised. The blood counts are so low that acupuncture with insertion of the needles and compromising the skin integrity is not recommended, at which point laser acupuncture can be very, very helpful for these patients. This is a fun one, cosmetic acupuncture. It does work. It's wrinkles and facial aging. Obviously, it's a broader phenomenon than just the skin on the face. But acupuncture being able to both relax the tight muscles, activate the lazy muscles, and also by the virtue of creating a little microtrauma in the skin every time you insert it, the body responds to the trauma by depositing collagen and elastin, which is exactly what we want. We want to improve the facial skin tone. So it does reduce the appearance of wrinkles. It slows down the aging process. We use acupuncture, again, the cosmetic acupuncture, not just symptomatically. We also look at overall aging pattern. So we look at diet, we look at habits, and try to come up with the comprehensive, individualized approach to aging. But throwing the icing on the cake and putting some needles in the face can actually help smooth it out and help with the wrinkles. The specifics, so just kind of logistics, risks of acupuncture, kind of straightforward: bleeding, infection. I've been in practice for 21 years. I've never had anybody have an infection, but it is a possibility. Vasovagal attacks, somehow robust, strong young men seem to be more prone to them. I'm not sure why. It happens in my practice for probably once or twice a year, but it is possible. So it's recommended that people eat and drink before acupuncture, because acupuncture can lower blood sugar and blood pressure. So it may cause wooziness, dizziness, and all of that. Damage to the viscera, any acupuncturist who knows what they're doing, barring some kind of idiosyncratic structural abnormalities, it's a very low risk of that. Nerve pain, acupuncture may touch a superficial skin nerves. There's no way of knowing them, so it's a possibility, which can then translate into a short-lived acute discomfort. Again, it doesn't happen often, but it's a possibility. Contraindications, again, pretty straightforward and common sense: open wounds, severe immunodeficiency, metal allergies, open fontanelles. We don't treat in my practice children under 13, but in my private practice before, I used to treat children from birth. So, shortly after. Local lymphedema, and also we don't use electroacupuncture with pacemakers. The treatment and frequency and duration, it depends. Again, if it's acute presentation, we usually see people a little bit more frequently, and for shorter duration of time, chronic presentation, usually once a week. We reevaluate after 4 to 6 weeks. That usually gives acupuncture is a cumulative process. Like anything, you diet, you exercise, you medication, the body needs to be given time to respond to that stimulus, so no difference here. And the 4 to 6 weeks will give me a pretty good idea how well the person is responding. Within 4 sessions, again, this is not a hard and fast rule, but for most part, I want to see some improvement in the symptoms. And at that point, if the patient is improving, it makes sense to continue until 1 or 2 things happen. They either recover completely and they don't need me anymore, or they will have reached a plateau and stopped improving, at which point this particular therapy is kind of exhausted for them. So now, let's talk about another of my favorite subjects, which is Chinese herbal therapy. There's so much discussions about Chinese herbal therapy because nobody really understands how it works. Chinese Materia Medica has probably one of the longest clinical trials. So yes, there's not a lot of double-blind studies on Chinese herbs, and especially the ways they are prescribed. And I will explain why that is. The Chinese medicinals, they're not just herbs, they are not just plants, they can be animal or mineral substances. They have a range, like anything. They can range from a food grade, things like ginger or onion, to digitalis. So it spans a range of applications and also safety concerns. But the trickiest part to understand Chinese medicine is that it has a very unique prescribing method. In Western medicine or Western herbology, it's usually substance A for condition B. In Chinese medicine, herbs are usually prescribed in a context of the formula. So as we were discussing before, in terms of coming up with a constitutional pattern of diagnosis, on the background of which a patient presents with their signs and symptoms. So we try to find out the Chinese differential diagnosis. We prescribe herbs according to that diagnosis. So their herbs are usually prescribed in the context of a formula between 2 to 20 plus ingredients. They work synergistically. They moderate one another. They have roles that they play. Again, going back to the poetics of Chinese medicine, herbs can play one of 4 roles. They can be a chief herb, which treats the principal pattern of the disease, the deputy, which assists the chief ingredient in treatment of the primary pattern, and or maybe a chief ingredient in treating a coexisting symptoms. The assistant herbs, which enhance the effect of the chief ingredient, but they also may moderate or eliminate the toxicities of the chief or the deputy, the first 2 ingredients, or it can have an opposite function of the chief ingredient to produce a supplementing balancing effect. And also an envoy herb, which is an herb that directs the formula to a specific organ or meridian, or harmonizes and integrates the actions of other ingredients. So purity and quality is, of course, a concern. And at Northwestern, we only use and recommend Khan herbs. But there are a couple other companies who manufacture the herbs under strict US guidelines, but it is a concern. Chinese herbs, because they are prescribed in such a unique way and not generally available on the market, I do not recommend that you self-prescribe Chinese herbs, because they need to be prescribed to your particular unique presentation, which is also the reason why there are not a lot of golden standard studies, because it requires for every patient to receive the same treatment. So we can have a study, for example, for migraines, but if I'm going to have 50 people in a study that represent 10 different patterns, they cannot receive all the same formula, which then kind of blows out of the water the standardization of the whole process. So that is a reason why there's also not a lot of money in it, because you cannot patent naturally occurring substance. When you seek Chinese herbal medicine, make sure you find a Chinese herbal board certified practitioner. For most states, not all, but for most, um, licensure is only required for acupuncture. So where master's degree with training in herbal medicine is for in most states required for licensure, the licensure does not require board certification in herbal medicine. That is a separate exam that we need to sit for. So if you want to get recommendations on Chinese herbal medicine, make sure that the person you're talking to is knowledgeable on the subject. And this is also something we don't, this is new. Chinese medicine, materia medica, all the accumulated amazing knowledge does not have much to offer in this era of modern medicine where often patients present on a number of different medications. There are some ways in which we could theoretically predict their interactions. In the beginning of my practice, I used to amuse myself by categorizing Western herbs as if they were medications. As if they were Chinese herbs. And based on that, I could predict fairly well whether the patient would have side effects, the particular medicinal. Because if they were, for example, taking Lipitor, which in Chinese medicine would be a damp clearing medicinal, and they had a very hot and dry presentation, that would not be an appropriate herb for them. So consequently, they would be more likely to suffer from side effects from the medicine than if they had more of a damp digestive presentation, at which point Lipitor would be quite appropriate. So a long way of saying seek professional guidance in this particular area. So, what else do I have to say about herbal medicine? Herbal medicine is always prescribed in accordance to the pattern in order to affect the pattern and bring about the homeostasis. So very often with Western medicinal, if somebody is diagnosed with some kind of ailment, they get on medication, and they very often have to stay on that medication for a long time because the way Western medicine works is by blocking or inhibiting the processes that lead to symptoms. Versus in Chinese medicine, the herbs are prescribed to support the natural and normal function of the body, tonifying the constituents, yes, releasing and getting rid of and clearing some of the pathogenic factors, but always goes kind of with the current of the body, going and adding what's needed at the beginning of the disease process so that the body can right itself rather than inhibiting and interrupting the disease process. The next modality of Chinese medicine is Moxabustion. Moxabustion, it's a heating technique, usually used a little cigar or some kind of compressed herb called mugwort, which is Artemisia vulgaris. And it has a multiple effects. It has a thermal effect, so it heats the body. It is antipyretic and thermolytic. It also has a radiation effect. So infrared radiation acting on the body will produce both thermal and non-thermal effect. Thermal effects are produced under the action of the electromagnetic waves. So the human body molecules absorb energy from infrared radiation and convert it into heat, and therefore promote blood circulation, improve the cell and enzyme activities. The non-thermal effects can provide the activation for the pathological cells lacking energy and then further adjust the body's immune and neurological functions. Moxa also has pharmacological effects. So the volatile oils of Moxa is about 0.5 to 1%, I think. It has a variety of biological activities such as expansion of the airway, smooth muscles, relieving cough, expectorant effect, and strong antioxidant activities. Moxa is also rich in flavonoids and polysaccharides, so it has a strong antioxidant activity as well. The smoke of Moxa can be used in air disinfection. It's antiviral, it's antifungal. It's been reported that has applications for wound infections and vaginal itching and uterine prolapse and common warts and all kinds of different things. Unfortunately, in the practice where I'm currently, we're not allowed to use moxa because it smokes. It smells like marijuana. So we would get in trouble at school all the time because police would keep coming in because somebody would report that we're all a bunch of potheads, but it smells very similarly, but it also creates a lot of smoke, which in order to light this herbal cigar, I have to wield an open fire, which is not okay, OSHA regulation, and also smokes can set off smoke alarms. However, in more private practices where that's not such a concern, you can use that. A Moxabustion is something also that I may potentially teach a patient how to do. I often use it with patients who are immunocompromised, their blood counts are low, going through chemotherapy, teaching them how to use moxa to stimulate a point that can have an impact on that can be very, very helpful for the patient. The next modality is cupping. So this is an ancient Chinese method of treatment. It creates a partial vacuum when the cups are created on the skin. It can be generated either by heat or suction. Again, we use suction cups because we cannot wield open fire. This draws the tissues up, and when the cup is left in place on the skin for a few minutes, the blood stasis is formed, the blood gets pulled in the area, and localized healing can take place. So it can lead to a local toxin release and activation of the lymphatic system, stimulates the skin, clears stretch marks, improves varicose veins. So it's, I think it's been popularized in the media. One of the celebrities was sporting it on the beach, and then everybody was coming in for cupping. But it does work. It's also great for people who are afraid of needles, and sometimes we'll start with cupping and sort of slowly introduce them to other things. Tuina, this is a traditional Chinese medicine massage technique. It's a hands-on body treatment. It's usually very localized to the area of injury, so it's not a relaxing whole body massage. It usually involves some deep manual stimulation. We do at the clinic, though, have fabulous massage therapists, so we don't spend a lot of time on Tuina, but it is one of the modalities of Chinese medicine. The next one's Qigong. Qigong is a meditation in motion. It has been studied quite extensively and found to have amazing benefits for blood pressure, endurance, cholesterol, hormone level, kidney function, mental activities, for libido, for flexibility, for balance, for strength, for even bone density. It also has been shown in some studies to decrease the free radicals production by stimulating the activity of superoxide dismutase. So it is an amazing, amazing practice. I was actually very humbled. I went to a continuing education conference one time, and they offered Qigong in the morning, and I am pretty fit. I work out quite a bit. I do yoga. So I went to easy, see you. I was brought to my knees. I was really struggling. So it's much harder than you think, but that's probably why it has all these amazing health benefits. So let's talk about a little bit what a visit, an Chinese medicine visit looks like. So not that different from Western visit, but we we pay attention to probably more things on a regular basis. So observation, so visual assessment, so the body type, the body language, the shen, which is spirit, the affect, the expression, posture, tongue diagnosis, part of the visual assessment, the listening, the smell, breath, body odor. All of these things mean something. Listening, so breathing, quality of voice, strength, clarity, speed of speech, so that gives me a lot of information. And palpation, so the body's cold or heat or hot or soft or hard, and we also pulse diagnosis, which I'm going to explain a little bit, falls into this category. Other things are not unlike what a Western allopathic medicine doctor would do, so comprehensive medical history, family history, social history, including stress levels and spirituality, emotional health, supports. But even though I practice Chinese medicine, I do look imaging and x-rays and MRI report. I do look at blood work. I find more information is better. So I will avail myself of all diagnostic tools available. But Chinese medicine has two very fun and interesting and useful unique diagnostic tools. The first one is a tongue diagnosis. So in Chinese medicine, every main organ is associated with different body tissues, different structures, different sensory organs, different channels, different meridians, different emotions, different tendons, different muscles, different ligaments. They create networks. At some point, each of these networks connects with the tongue. So the tongue's color, moisture, texture, the quality of the tongue coat gives me a lot of information. Tongue is also the only muscle you can look at. So it gives you a pretty good idea of the rest of the tissues are going to look like. So you can see the geography of the tongue, as in the back you have kidney, bladder, intestines, liver, gallbladder, heart, lung. So whatever is happening in those areas will actually give me a lot of good information. This is the different, just kind of fun examples of what the tongue can look like and what we are looking at. This is what real tongues look like. So just have them arrive here all nicely. So the bottom right, for example, that's a patient with a lot of digestive weakness and digestive issues. The one right above them with that purple tongue, that's a person with chronic pain. The one on the top left is a person with a lot of inflammation, high blood pressure, and the person in the middle is the person with the rheumatoid arthritis, a lot of damp and heat and inflammation in the body. So there's as many tongues as there are people. What do normal tongues look like? It should be nice and pink with a thin white coat that looks like it's growing out of the tongue with just a very mild kind of moisture to the tongue, and underneath the tongue the veins should be invisible. That's what a normal tongue looks like. I haven't seen too many of those, but that's in theory what a normal tongue would look. The next diagnostic tool is a pulse diagnosis. So again, each of these organ networks connect to the radial pulse, and every position on the radial pulse underneath the three fingers correspond to a different organ system. So the ones on the right, the ones that is closest to the hand, so the most distal ones, lung, large intestine, spleen, stomach, kidney, urinary function, more kidney young, versus on the left side is heart, small intestine, liver, gallbladder, kidney, and more of the reproductive function and the kidney yin. The diagnostic goals are differentiate between acute and chronic conditions, what organ systems and tissues are involved, determine if the source of pathology is external or internal in nature, and establish the underlying constitutional patterns, as we said, using the 8 principles, the different meridians, collaterals, Zanfu, all these kind of different strategies for organizing symptoms in the body. Let's see. So Chinese medicine obviously is a very good interventional tool, but the underlying principle of it is prevention. There is a beautiful quote from the Yellow Edgar's inner classic that treating illness after it has begun is like suppressing revolt after it has broken out. If someone digs a well when thirsty or forges weapon after becoming engaged in a battle, one cannot help but ask, are these actions are not too late? So prevention is a big deal. And yes, I do treat primarily people for intervention. They come in when something's broken. Often I'm their last resort. But when we resolve their condition, I often recommend that they continue using Chinese medicine as a preventive tool, because there's no such thing in Chinese medicine as symptom that means nothing. No matter how minute, how obscure, how seemingly unrelated to primary complaint, every symptom points towards an imbalance somewhere. And if you can identify imbalance, you can address it. If you can address it, you can bring someone closer to the perfect health end of the spectrum before something shows up on a clinical diagnostic test. So what is cultivation of health and disease prevention in Chinese medicine? Is adopting natural and constitutional specific diet. So there's no one size fit all. It's always funny to me how human beings as a species, we are just the only one that haven't figured out what to eat. But there's such a broad variety between us that we don't work the same way. We don't thrive optimally eating the same diet. So again, constitutional specific diet is not unlike what we talked about in the way we prescribe Chinese herbs. And that is a person with a very hot and dry presentation is not going to do very well with spicy, hot foods with a lot of meat. A person with a lot of spleen and stomach deficiency, a lot of dampness, is not going to do great on a lot of raw salad and a lot of dairy. So we need to look at foods being chemicals, very specifically affecting a person's biochemistry. So what is it that we're trying to accomplish, and how can the food be the best way to support their health and recovery and just health and wellness, period. Regular exercise and activity. In Chinese medicine, aging is a function of stagnation. When things stop moving, you age and you die. So regular exercise and activity is the way to deliver these beautiful nutrients that you've just consumed into every cell in the body, and make sure that you use it, because if you don't use it, you lose it. So regular activity and exercise is going to be a key. Adequate sleep. The body heals. We know that from Western medicine. The body heals in sleep. Your brain cools down in sleep. The body regenerates. Without sleep, nothing happens. People who don't sleep, they hurt. I've seen a lot of fibromyalgia patients. There's some debate about it, but I am yet to meet a fibromyalgia patient who doesn't have sleep problems. So what's first, the chicken or the egg? I don't know, but often when we address sleep, the pain, inflammation, and a lot of things go away. Stress management, that's a given, and this is an entire 50-hour seminar on stress management, so I'm not going to touch that, but Chinese recognize that that's the internal evils, is the idea that unresolved emotions will affect physiology. Now we know in Western medicine that number one predictor for heart disease is not smoking, drinking, and alcohol, and lots of beef, but it's hopelessness. It's the emotion that's most indicative and predictive of heart disease. So stress management is key. No overindulgence in food and sex. That is all about just moderation. It's really that simple. And protecting the body from the environment. An environment means, too much cold, too much hot, too much dry, too much pollution, not using chemicals on your skin, not using chemicals in the home. Again, going back to living as a part of nature. And last but not least, cultivating relationship and social support. We are social creatures. We cannot survive without people. So this brings me to the last piece of our talk. There's a work of Dr. Michael Smith at Lincoln Hospital in New York City in the late 1970s. That led to the formation of National Acupuncture Detoxification Association, the NADA, and the codification of the NADA protocol. So it's 5 needles inserted at specific points in the ear. And research showed that before the individuals can overcome chemical addiction, attention must be given both to alleviation and of the diverse array of the mental and physical stress impacting their life, as well as the comprehensive restoration of community infrastructure. So it is a protocol that addresses both the addictive component and the stress component of the drug dependency. And I am not insinuating that any of you are addicted. However, if we look at our lives, we often are addicted. If we're not addicted to substances, we may be addicted to emotions. We can be addicted to watching TV, to eating food, to going on our phones. And usually any kind of addiction is a function of stress, and we engage in a lot of behaviors to divert our attention, to de-stress, to decompress. So this protocol is meant to alleviate a lot of these emotional, a lot of these physical symptoms that we suffer as a result of emotional drama that we experience in our lives. So without further ado, this is the protocol. So the effects of a decreased stress and anxiety, more optimistic outlook. Those are research-backed effects. The reduction in chemical, drug, alcohol, sugar cravings, fewer episodes of sleep disturbance, and reduced need for pharmaceuticals. So I broke it down for you here into a specific points with a little bit more information on each one of them. You can read the slides. This one in particular merits a mention, Shen Men, which is the spirit point. When my son was very young, I used to walk behind him and sneak in and slap a magnet on it when he didn't know. And within 15 minutes, I had a different kid. This was also a point which we used before exams, any kind of stressful situations. It does significantly lower the sympathetic response, and it calms very quickly. You can use a magnet in there, can use a needle in there, but you can also stimulate it manually with acupressure for about a couple of minutes with a fairly strong application of some pressure on it. So here are the other points. That's the kidney point, which also have an effect on sleep, night sweats. Liver points, which is in Chinese medicine and French and Western world also used for any kind of liver issues. But also liver in Chinese medicine has a lot to do with stress, anxiety, depression. So it has an impact on sort of that aspect of that particular organ system. Lungs, lung in Chinese medicine is an organ of grief. So it does treat physical things. Skin is also part of the lung organ system. So it does help as well with the pain relief. And sympathetic is, as it describes, this little triangle in terms of location. The triangle means the point is not on top of the crest of the ear. It is in kind of in the fold. So if you are following the edge, the inner edge, you will run into it right underneath the little fold if you want to locate it best. So, the last but not least, traditional Chinese medicine as a part of integrative care. The beauty of working at an integrative medicine center is that I know nobody has all the answer. And the best thing about Chinese medicine in this context is that we can bring together the best of human knowledge and mix and match and take pieces of it and design the best strategy for any particular patient. If I have a severe infection, I am not messing with acupuncture and I'm not messing with herbs. I'm going to get myself some antibiotic. If I have a significant injury or trauma or an accident, I need to see my ortho. I am not going to be messing with acupuncture. So knowing what acupuncture or Chinese medicine, at some instances it can be a primary therapy, in other ways it can be an adjunctive therapy. I would never treat cancer with Chinese medicine, but Chinese medicine can be amazingly helpful as a supportive tool for patient going through this very harsh treatment, both in assisting pre and post surgically, assisting in moderating side effects of chemotherapy. So there is a time and place for everything, and Chinese medicine works really well in the context of Western medical world, plugging up the gaps where the Western medicine it's not at its strongest, and supporting it so it can be even better. So I hope this is a good introduction to Chinese medicine. I hope you're excited. I hope I stirred up some questions. You can reach me at this email at agrimon@nm.org with any questions. And I am looking forward to continuing our conversation about Chinese medicine and how it can benefit both the patients and also our Western medical system. Thank you for your attention, and I look forward to connecting with you.